Good day, doctors. This is Dr. Platero. I'll be discussing peripheral IV insertion. Peripheral IV insertion is a generic skill that most students should learn in their medical education. A catheter is inserted into a vein, allowing venous access used in the administration of fluids and IV medications. These are some of the indications why we do peripheral IV insertion: for repeated blood sampling, intravenous fluid administration, intravenous medications administration, chemotherapy, nutritional support, blood products administration, and intravenous administration of contrast agents for CT scan, MRI, and nuclear imaging. These are some of the basic equipments when we do peripheral IV insertion: gloves, alcohol swab, tourniquet, tape, gauze or cotton ball, catheter of appropriate size, IV fluid bag such as your plain NSS or plain LR, tubing set, IV pole, and infusion pump if required. These are the basic parts of an IV cannula. You have your needle and your catheter. Remember that your needle is much more longer than the catheter, and this needle is being housed inside the catheter. And we have also the bushing. Please take note that this area should be sterile at all times. Do not touch this area as you will contaminate this with bacteria, and as you insert this in the hand of your patient intravenously, you will be introducing bacteria and may cause septicemia at the worst scenario, or phlebitis. We have your wings, which will support your index and middle finger, injection port cap, wherein you can also administer your IV medications through this port, lower connector, needle grip, which will support your thumb, flashback chamber, wherein you will observe for the flashback of blood, especially when you are already inside the vein, and the lock plug. Again, this area should be kept sterile at all times. This shows a magnified view of the tip of your cannula. And as I have mentioned earlier, that the needle is much more longer than the cannula, and your needle is being housed inside the catheter, the plastic catheter. So this box shows the different sizes of the catheters. We have your gauge 14, which is orange in color, gauge 16 for gray, gauge 18 for green, gauge 20 for pink, and gauge 22 for blue. We also have gauge 24, which is yellow, which is commonly used among pediatric population. Commonly used gauge for the adult population is gauge 20. That is your pink IV cannula. These are the example, the images for the different size, the different gauges. You have your gauge 16, gauge 18, which we often use for blood products administration, gauge 20, and gauge 22. Your gauge 24 is the yellow one, which we commonly use in the pediatric population. This image shows the anatomy of the veins of the hand. The first choice are the metacarpal veins, as they are located on the back of the hands, which are easily accessible and more difficult to dislodge. In your return demonstration, you will be inserting your IV cannula at the metacarpal veins. These are some of the things to remember when doing peripheral IV insertion. Avoid probing around blindly under the skin during cannulation. Avoid venous valve damage by not cannulating where the vein bifurcates or divides into two, because damaging a valve can increase the risk of thrombosis. If arterial cannulation occurs, remove the cannula immediately and apply direct pressure over 5 to 10 minutes. That is to prevent bleeding. Avoid intravenous insertion on the palm side of the wrist and avoid the large cephalic vein at the level of the wrist. Choose an insertion site 10 to 12.5 centimeters above the level of the wrist. Withdraw the catheter immediately if paresthesia, such as tingling sensation or numbness, is being elicited. Choose a relatively straight vein and one with a diameter and blood flow to adequately hemodilute the prescribed therapy. Aside from this one, make sure that the length of the vein can accommodate the length of the catheter. Other things to remember: avoid starting intravenous lines in veins that are located in areas of flexion near the wrist joint close to the nerves. Avoid the feet or leg veins due to the risk of embolism or thrombophlebitis. Avoid areas below a previous IV attempt or a previous infiltration due to the damage that may have occurred. Avoid IV insertion in sites with signs of inflammation, fracture, trauma, infiltration, or thrombosis. Do not insert in a limb with indwelling fistula or shunt, because when you apply your tourniquet, this indwelling fistula or shunt will be rendered useless. And this fistula or shunt are sometimes used for access, for port for hemodialysis. Do not insert in a limb affected by breast surgery, because it might affect the surgeon's technique during the surgery, and it might contaminate the tubings, also might contaminate the surgical site, the surgical field. Try to avoid the antecubital fossa. Although this is often the easiest place to see and feel for a vein, catheters at that site can become kinked and blocked as well as cause pain for the patient on bending the arm. Bring a selection of different size catheters to the bedsides, allowing you to choose a smaller gauge if you experience problems. And don't be afraid to ask for assistance from the nursing or auxiliary staff. This is how you apply your tourniquet. Make sure that you can remove your tourniquet just by pulling one end. And make sure also that the ends of the ties are directed towards the patient, not towards the physician or towards the IV site, as this will contaminate the IV site. So this is the image of your cannula underneath. So this cannula is gauge 20. And how do you peel this open? So at the edge of the cannula, one of the edge of the cannula, you have here peel open. You just need to peel this off for you to remove, for you to be able to get the cannula inside. This video is showing you how to prime, how to start an IV line. So we have prepared now your bottle, and the tip of the bottle should be sterile at all times. We have your IV tubing here. Make sure that the needle for your IV tubing is kept sterile at all times, and you just need to poke this one and let the fluid run through the IV tubing, making sure that there is no air inside the tubing, as this can cause air embolism. So you just need to open the regulator, the IV regulator, and keep the fluid flowing through the IV tubing, making sure that there is no air inside. Please do not let the end of the tubing touching the floor. You need to keep it sterile at all times. These are the basic IV tubing set that you need to familiarize when starting an intravenous line. We have your macro set, and this one is micro set. What's the difference between the two? So your macro set is used for large volume delivery, especially in the adult population, while your micro set is used for small volume delivery, especially among pediatric population. So as you can see here, we have here the macro set. We have a bigger needle here with a wider diameter, and this one, smaller needle, smaller diameter. Take note of the drop. The drop of the microset is way smaller compared to the drop of a macro set. So how many drops is needed to create a 1 ml of fluid for macro set? For macro set, you need 15 drops for this one. In some manufacturers, 20 drops. So 15 drops for this one to create 1 ml. While for micro set, you need 60 drops to create 1 ml. So again, this is macro set used for large volume delivery. Usually used in adult population, and this is microset used for small volume delivery, especially in the pediatric population. This is an image showing your IV cannula as you remove this from the packaging. So we have your wings here and your needle grip. So as you removed from the packaging, you need to flatten the wings. And how do you hold the IV cannula? So these are some of the ways now how to hold your cannula. So we have your wings here. So with your wings, you have your index finger and your middle finger. And your needle grip, behind your needle grip is your thumb. Make sure that you are not touching the catheter. So this shows another view. We have your index finger and your middle finger. I'm not touching the cannula, as this prevents contamination. And you have your needle grip, and behind the needle grip is my thumb. This also shows another way of holding your cannula. So instead of my index finger on the wings, I've placed my index finger at the injection port. And sometimes you can also place your thumb behind the lock plug. So this is how you place it, behind the lock plug. But make sure also, if you place your thumb behind the lock plug, make sure that you really need to stabilize your hand, because if you place your thumb behind the lock plug, just a little movement might affect the direction of the needle. So as to minimize, so avoid doing like this, but instead you place your thumb behind the needle grip. But if you're already an experienced technician or experienced doctor doing IV insertion, and you are very confident already, you can place your thumb behind the lock plug. And also, if you place your thumb and middle finger over the wings, make sure that you place it at the tip, near the tip of your middle and index finger, not at this area, because you will have difficulty in lowering the angle. I'll be showing you a video on how to insert an IV cannula. So we have here the tourniquet placed on the arm of the patient. So again, the ends of your ties should be directed towards the patient and not towards the site or not towards the physician. And make sure also that you can remove this tourniquet by pulling only one end of the tie, and you can loosen it. Your objective here is to block the passage of the blood returning to the right side of the heart, such that if the blood will pull inside your veins, the veins will be engorged, and this will be much more visible for IV insertion. Again, choose a relatively straight vein and do not insert on the bifurcation site, as this has valves, and if you insert your IV catheter or IV cannula on the bifurcation areas, you will be damaging the valves, as this can cause thrombosis. Look on how the doctor is holding the hand of the patient. The doctor is applying tension on the skin by pulling it underneath, below the knuckles. Do not place your hand above the knuckles, as this can contaminate your needle during IV insertion. So it should be below the knuckles, distal to the knuckles, applying tension over the skin, as this can stabilize your vein. So you cleanse the site 3 times using a circular motion from inside to outside. So the doctor is using an alcohol swab here. So the doctor will be accessing the metacarpal veins. So clean the site with a cotton swab from inside going outside in a circular motion. So this is to lessen the bacteria at the IV site or your puncture site. Again, you do this 3 times. The doctor will be using a gauge 22 needle. So again, you apply tension over the skin. You hold the cannula. Okay, you hold the cannula, your index and middle finger over the wings. And if you're already confident, you can place your thumb behind the lock plug. Or if you are not yet confident, you can place your thumb behind the needle grip. And again, applying tension over the skin to stabilize the vein. So you need to approach the vein at 15 to 30 degree angle. Some references 10 to 20 degree angle. So again, during my initial presentation, the tip of the vein, the tip of the needle, the cannula rather, will be the needle, and the length of your catheter is much more shorter than the needle, such that the needle will be touching first the skin of your patient. So poke. So now you approached the vein, you have poked the skin, and then you advance your needle thereafter. You slowly advance. So once you have hit the vein, you will be feeling for a popping sensation, and you observe the flashback chamber, because if you are inside the vein, blood will be seen or will be observed in this area. Okay, look. So there is blood coming out. So it means that you are inside the vein. So once you're inside the vein, you grab the needle grip and retract it just for a few millimeters only. You retract the needle by retracting the needle grip. Okay, now look, the needle grip is being retracted, and now blood is seen over inside the cannula. Once you have retracted the needle grip or the needle, you move the cannula forward. Now imagine that it is no longer the needle that is advancing, but rather it is now the plastic catheter that is advancing inside the vein. It should be smooth, because if it is not smooth, it means that you have infiltrated or you are outside the vein, or you have hit a valve. So thereafter, you apply your tape. Make sure that you have taped your wings and remove your tourniquet. You relax the hand of your patient. Then you press your thumb over the vein. Do not apply pressure yet, because the needle is still there. You apply pressure once you have removed the needle. And once you have removed the needle, you now can attach your IV tubing. Okay, once you have removed the needle, apply pressure immediately, so as to avoid blood dripping out from your IV cannula. And now you are now ready to attach your IV tubing. So you need to rotate your IV tubing. Secure by applying more tapes. Okay, you apply also a tape on the IV tubing, so as not to to prevent this from dangling on the floor, as not to disturb as well the patient. So that's it. There are cases that you will not attach the IV tubing to the IV cannula. So you can use your lock plug, which was initially connected here. You can remove that one and attach this to the patient instead of the IV tubing set. And once you have removed the needle, this catheter will be the one remaining inside the vein. And again, if you have hit the vein, when you advance your cannula, it should be smooth. If you feel some resistance, do not, and you have already removed the needle, do not attempt to reinsert the needle, because sometimes the catheter is because sometimes the catheter is kinked already. So what will happen if you attempt to reinsert the needle on a kinked catheter? This will happen, and the worst thing, this catheter tip might be dislodged from the tip of this one. The tip of this catheter might be dislodged, and this will cause embolism. So do not reattempt to insert the needle if you have already removed it. Next is how to remove an IV catheter. Okay, I'll be showing you a video on how to remove an IV catheter. So sometimes the tapes are so difficult to remove, so you need to moisten the tape underneath with an alcohol. Underneath, make sure that you have turned off the IV regulator. So the doctor is moistening the tape underneath to loosen the tape. So you get a dry cotton. Get a dry cotton and place it over the puncture site. Okay, just place it over the puncture site. No pressure yet. Do not apply pressure yet because the catheter is still inside the vein. You apply pressure only when you have removed the catheter. Apply pressure once you have removed and apply the tape. That's it. That ends my lecture on peripheral IV insertion.